The musculoskeletal video was super interesting to me. Getting to see Brett use the ultrasound showed me a lot of things that I've never seen before, such as the contracting and relaxing of muscles under the view of the ultrasound. Getting to see the fascia slide things around, it really puts an image to the words that we've heard. Makes it a little bit easier for me to envision now when I hear about all this stuff. Along with hearing Brett mention the difficulties that come with using the ultrasound, how if it's not done precisely, there could be some sort of misdirection. If everything's not lined up, it can get a bad reading, which could lead to a misdiagnosis. Okay. And ankle evaluation, we'll start with a past and present history, along with inspection, looking for any swelling, deformities, or discoloration. Bony palpations, we'll start with the shaft of the tibia and the fibula, looking for any fractures. Lateral and medial malleoli, also looking for fractures. The dome and the neck of the talus. Soft tissues, deltoid ligaments, anterior, mid, and the posterior ligaments, looking for sprains. Anterior tibiofibular ligament right here at the intersection of the tibia and the fibula. Lateral ligaments, would you mind turning your leg a little bit? Okay. The anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. All right. And the peroneal tendons, checking for tendinitis or subluxation, right here, going all the way up. All right, special functions test. First, we'll do the squeeze test, squeezing the tibia and the fibula, looking for any fractures or if there's any referred pain. Next, we'll be doing the calcaneal bump test, checking the tibia and the fibula also for any fractures. Okay. Stress test. We're going to start with inversion. All right, plantar flexion and inversion, we'll be testing the ATF. 0 degrees inversion, we'll be testing the CF. And dorsiflexion and inversion, we'll be testing the PTF. Eversion, dorsiflexion with eversion, we'll be testing the deltoid ligaments anteriorly. 0 degrees and everted, mid, plantar flexed and everted, posterior. Anterior drawer test, we'll be testing the ATF and the anterior deltoid. We'll be pulling upward, making sure I have my hand on her ankle, right? And the posterior drawer test, testing the PTF, I'll be pulling downwards. Perfect. Range of motion, we could do either passive or active. I'll do this myself. So we're going to be looking for dorsiflexion right here. Dorsiflexion right here at 20%. Plantar flexion down to 50%. Inversion at 5%. And eversion at 5%. All right, muscle strength test or resisted range of motion. Start with plantar flexion, which will test the gastrocnemius, the soleus, and the tibial nerve. So what we're going to do is start here and push down, down, down with your toes, down, 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 down. Back up, down, 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 all the way to plantar flexion. Good. Dorsiflexion, the exact opposite. It'll be the tibialis anterior and the deep peroneal nerve. Go ahead and pull up, up, up. Again, up, up, up. Okay. Inversion, testing the tibialis posterior and the tibial nerve. Go ahead and move your ankle inward, inward, inward. One more time. Inward. Here we go. Eversion for the peroneus longus and the brevis, the superficial peroneal nerve. Go ahead and outward, evert. One more time. Eversion. Good. Okay. Neurological tests, motor tests. L4, ankle dorsiflexion and inversion. So go ahead and put it up and inward. Okay. L5, toe extension, extend your toes upward. All right, S1 ankle eversion, turn it to the side. All right, and then S1 and S2 will be ankle plantar flexion, so all the way down. All right, sensory nerves, the L4 right here, L5, and S1. All right, if you give me this, flip over. All right, reflex test, S1 right here, the Achilles tendon. Okay, you can come back. Here you go. All right, blood flow test. Start with the dorsal pedal artery right here. Feeling for a pulse. Got it. Recapillarization. Since there's toenail polish, I'll look on the bottom. Squeeze. Color should return within 2 to 5 seconds. All right, and then I would compare bilaterally.